Thank you very much for listening to us here on stage. I would like to kick us off with a question. Did you know that leading life scientists claim that the first human to live for 250 years is already born today? 250 years. Wow. I mean, it sounds incredible. What is driving this? It is rapid advances in merging infotech and biotech through data-driven into the future by combining these technologies into human health and well-being. But what does it mean in terms of the future for us as a global community? Let us quickly go to Liberia. Kumba, a girl born today. What is her life expectancy? It's around 50 years. So we are talking about potentially a 200 years difference in life expectancy depending where you are born in the very near future. This has major implication for us as a global community. It might erode all the health equity gains that we made in the last 50 years. And not by a small margin, but by a very, very wide margin. So what is actually driving all of this? It is data. If we take a historic view, the last millennials, the most important asset to create wealth in society was land. We had feudal systems, and lots of people were in slavery working on these lands. Since the Industrial Revolution, around 1750, machines became the primary sort of production and asset in society. But very rapidly, since 2000, it is data that actually is the most valuable and asset to create the economic productivity. Now this has significant implications, and let's just stop and reflect. Do you know that 90% of all of the world's data today was only generated the last 2 years? So this is totally transforming. Now if we look at the fourth industrial revolution within the segment of health, there is a clear sort of convergence of three technologies. On one hand, we have a rapid explosion on data from social media, wearables, clinical data. We have environmental data, genomics, even geospatial data that all gives us insights into human health and well-being. The second sort of convergence is that artificial intelligence and algorithms become increasingly sophisticated with technologies that are under AI like machine learning, natural language processing, and deep learning. And the third sort of emerging technologies is driven by supercomputing. One day we will have quantum computing, which will be 100 million times faster than the fastest computers we have today. Today in the world we have about 8 billion interconnected devices. In about 4 years from now, there will be 23 billion interconnected devices that are powered by 5G that's globally being rolled out right as I speak. But there's a big challenge, and I go back to that issue of the Liberian girl born today. Harari, in his excellent book, 21st Lessons for the 21st Century, wrote in this sort of very pointing issue around data. If we want to prevent that all power and wealth is concentrated into a very small elite, the key is to regulate data ownership. Now it's really time to act. And here, as a wonderful, energized community at Women Deliver, I think we have an important role to play. We have to understand that data ownership increasingly means people ownership. And we're really at risk, if we are not fixing this, that we are becoming modern-day data-driven slaves. owned by large corporations who are driving their business through data ownership. So what does it take within health? We need collectively create a movement that calls for health data to become a global public good. We need to drive that the World Health Organization with the World Health Assembly is putting together very quickly a framework convention on international health data or an international health data regulation. If we can achieve that, and that's the upside of it, if we really together can change that, we have the ability to totally leverage AI and associated technologies in the years to come to ensure that we have improved human health and well-being for all. Thank you.
Thank you very much. It's really interesting because the work that I do on our initiatives is to notice how data is lacking really on the sex disaggregated analysis, in many, many different topics around the workplace, around health, and we see data biases, right? So are we seeing this data bias, continue into the artificial, the AI, all that spectrum, and what are your thoughts on that?
Well, I think that's a major issue which this collective community here at Women Deliver should take very serious, especially gender biases within data. And the other problem is that majority of developers of these technologies are actually men. So we are usually participating at the World Summit AI, and there's at least 90% of the participants are men. And we really rapidly need to change that because they build into these algorithms gender bias. And then the training sets from data. If you take some of these facial recognition on your mobile phones, they work beautifully for a white male like myself. I can use them at night in bed and they actually work. If you are a dark-skinned female, they don't work. And that's just one example how there is really gender bias built into some of these solutions.
Okay, so it wasn't my fault that my phone couldn't turn on then.
No, it's not at all your fault. It's the bias within the algorithms that actually create this.
Right, and with the Fondation Botnar, you're doing a lot of work already as a male ally, but what are, and you're doing such fantastic work, what more and what do you commit after coming to this conference and talking to all these advocates on women's issues?
So there's two things. One, we just launched this week. We are having a partnership with Women Deliver to expand their Young Leaders program over the next 3 years to have 1,000 more young leaders into the program with a very strong focus on digital leadership. We need the digital natives, really the young people, to drive these changes. That's the first one. The second one, we're in discussions with the organizers of the World Summit for AI to work with partners like Women Deliver and other organizations to call a massive sort of global young women's championship for AI, specifically from low and middle income countries, which we hope to launch sometimes next year in October at the World Health Summit, at the World Summit for AI, to really make a drive to identify these young women's in talent in AI and really support them, coach them, and bring them to the front to address some of these challenges.
Wonderful, and as I've held other speakers to their commitments, I will hold you to yours and check out this AI Summit next October.
Absolutely, do that.
Thank you so much.
Thank you so much.
Appreciate it.
Thank you.